Welcome to the Medical Claims Trends in a Work from Home World webinar. I'm your host, Christopher Maggot, Senior Talent Development Specialist at NFP. Should you have questions during the call, please submit them using the Q&A function on your Zoom menu bar located at the bottom of your screen. We will compile questions there and then answer as many as possible at the end of the call. At this time, I will turn it over to Alicia Henderson, Senior Vice President, Benefit Services at NFP Canada. Alicia, the floor is yours.
Thank you very much, Chris, and thank you to everyone for joining us today. We have had just a tremendous response of attendees, so very excited for all of you to join us for what I think is going to be an extremely informative webinar. We've got a fantastic lineup of speakers today. Each of them has a slightly different vantage point, I think, on the current working environment. So I think there will be lots of insights to glean from these experts. I'm sure I don't have to describe to you the impact this global pandemic has had on organizations across the country, with many organizations shifting all or a portion of their workforce to a work from home arrangement. And while the pandemic has changed things greatly in 2020 and even into 2021, I think it's also shaping up to change the ongoing workforce and the approach that we take to work on a day in and day out basis. Statistics Canada actually estimates that 22.5% of businesses will continue to have at least 10% of their staff working from home post-pandemic. So this extension of the work environment, as well as organizations planning for the return to office, has brought about several different issues and concerns for employers as they continue to adapt in this I guess we'll call it the new normal environment. So today's call is really going to deal with some of those trends observed by our expert panel. We'll focus on a few key areas, such as remote work challenges, returning to the workplace and challenges that might be observed there, managing accommodations, disability requests and submissions, and employers' duties as it pertains to a safe workplace. So I know that in the next 40 minutes or so, there will be some terrific information shared. But given the variety of topics and limited time, we will delve right in. Each of the speakers is going to spend about 5 minutes and provide some of their findings and their perspectives on the trends that they are observing. And then we will follow up with a panel discussion and Q&A. Thanks to those of you that already have posted your questions, as you registered. If there is anything, please add it. If you do have a question as we're going through, please, put it in the Q&A box, and we'll do our best to address those at the end as part of the panel. So first up is Stephanie Mclaughlin. And I won't read all of Stephanie's bio here, but she's a labor and employment lawyer providing representation on a wide range of labor, employment, human rights legislation. And so you can read about Stephanie, but without further ado, I will turn it over. And Stephanie, thank you for joining us.
Thanks very much, Alicia, and very nice to virtually be with you all today. So from the perspective of a management side labor and employment lawyer, as Alicia already touched upon, many of the key issues facing employers in this area that we've been assisting with fit into 3 categories. The first being remote work issues. So evidently, COVID has forced employers to balance their obligation to provide a safe workplace and report injuries and illnesses with the many difficulties that come with monitoring their employees who are working from their own homes, where the employer has little to no control over the employee's physical workspace. So in particular, we've addressed a lot of concerns from employers who are struggling to track their employees' hours of work, struggling to monitor whether their employees are actually completing their work, or struggling to monitor whether their employees are both physically and mentally safe in their at-home workspaces. And an emerging issue that we've seen with remote work as the pandemic fatigue has grown is an increase in issues related to working remotely, whether it be from another province or actually another country. And it may seem on its face to simply be a matter of, picking up your laptop and placing it in another location, but there are a whole host of issues associated with these arrangements, from the more obvious taxation concerns to even which employment standards legislation applies. And the second main category, as you'll see on the slide there, is return to the workplace issues. Evidently, a lot of employers who have had their employees working from their physical workplaces have been dealing with this for over a year now, but there continue to be evolving health and safety considerations ranging from wearing PPE to work refusals. And now that is interacting with vaccinations and, of course, the COVID variants. For example, we've seen a fair number of refusals to return to the workplace before herd immunity is achieved through vaccination, which isn't exactly something an employer can easily measure nor agree to. And then as the lockdowns and government measures continue to evolve, we've also seen new and changing requirements mandated by the government in each workplace, such as daily questionnaires to now a fair number of forced outbreak closures. But we do expect these workplace requirements to continue to change as we hopefully eventually emerge from the pandemic, as vaccination levels increase and more individuals start to return to the physical workplace. And then lastly, a category that really does apply to both remote work and returning to the physical workplace is leaves and accommodations. So firstly, employers have had to and continue to have to consider eligibility for job protected leaves of absence under the employment standards legislation, which has been a bit of a moving target during the pandemic across the country, with several new leaves of absences either being created or amended. And now we've recently seen quite a number of changes to sick leave or vaccination leave. So it's important for employers to understand and confirm whether their employees qualify for a job protected leave of absence versus a leave of absence as part of a human rights accommodation. And the two key human rights categories that continue to be at issue during the pandemic are family status and disabilities. So you may have seen this as well, but we've seen a lot of issues around immunocompromised individuals or childcare obligations, but we're also seeing a lot of emerging issues in the mental health field as people start to express a lot of fear around returning to the physical workplace. So for example, a few weeks ago, I dealt with an employee who had contracted COVID last year. He was quite young, but was now afraid of returning to the workplace to potentially now contract a COVID variant. So one takeaway that I think I want to leave you with today that applies to all three of these categories is that, as simple as it may sound, it's really important to check in with your employees. So for example, check in informally through a virtual water cooler type chat, but also formally check in with your employees as provinces start to open up again, particularly those who have been accommodated in some manner or another during the pandemic. So those are the three key categories we've been seeing a lot of in the legal field during COVID, and I look forward to discussing these topics today.
Thank you, Stephanie. Our next speaker is Dawn Yearwood, and Dawn has extensive experience, I think it's over 20 years, in disability management, working with a firm called Acclaim Disability Management and leading their disability management practice. Obviously, there's focus here on both occupational and non-occupational absences. So Dawn's going to have some great perspective, and I will turn it over to her now.
Thanks, Alicia. Thank you, everybody, for your time today. So I'll spend just a few minutes maybe adding on to some of the things that Stephanie had mentioned with respect to being at work or the inability to be at work. And just to give context, I wanted to share some of the data that we at Acclaim had compared from 2019 pre-pandemic to 2020. And we did see about a 5% decrease in actual total new short-term disability claims. The number on the workers' comp side has ballooned. That information is still being calculated because of the COVID files that we have been assisting our clients with as well. But where we saw we saw an overall decrease. However, we did see an increase in activity in a couple of industries. So for one, healthcare, I think that's fairly self-explanatory, manufacturing and retail. So the essential frontline type positions is where we saw an increase in short-term disability claim incidents. So that was interesting. And what I can say about our total book for 2020 is that 11% of all claims that were managed that year were directly COVID related. So it was very prevalent in the work that we saw across the country and assisting our clients in navigating how to determine who would be eligible for disability as per their plans or who needed another regulated leave. And really teasing that out, as well as looking at accommodation requests. What we did see is that some of the absences and short-term disability claims that we would normally expect to resolve within a few weeks really did drag on and extend. And that ended up with an increase in long-term disability transitions for a lot of our clients. And that translates to cost, obviously. But with the shutdown of the economy and having access to treatment being cut off, that was a significant contributing factor to employees who needed care, needed to recover, and the recovery being prolonged. And as well, we also had to really look at being creative and pivot. And it's not just us at Acclaim, but our other counterparts in the industry providing these services. Was the claims adjudication. We had a lot of complications and some challenges with regards to securing the appropriate documentation that we needed to validate certain claims. A lot of accommodation requests. As Stephanie mentioned, there was a lot of fear, anxiety about returning to the workplace. Some individuals who wanted to, or were looking to medicalize perhaps conditions that they had previously as a way to avoid going into work. So a lot of conversations with our employer clients about flexibility and what they can do to be open to having individuals continue to work, but perhaps not from the office if they didn't actually need to be there to have the job be completed. Like I said, in terms of challenges with adjudicating claims, I mentioned obtaining documentations. Doctors' offices were not closed. Physicians did not want to see their patients in person. So a lot of phone consultations we're having, but very difficult to determine objective clinical pathology versus subjective wants and needs from the patients. Specialist consults were nil for a period of time at the beginning of the pandemic. And that delayed, there's a backlog for people to be able to see specialists. And as well, we know some surgeries were canceled as well. So that did prolong recovery in a lot of instances and required the transition then to a long-term disability. We've also had to utilize our medical director quite a bit to really determine and tease out what's medical and disability in terms of the claims that we're seeing and what may be an accommodation or a situation that may require an alternate leave, such as ones that Stephanie had talked about. So if I can leave the employers with any takeaways or action items, it would be, as we are still navigating the COVID world and disability with return to work practices and what's safe and what can work for the employers, flexibility is key, where we have very strict processes and timelines for the adjudication process for short-term disability. We need to meet timings and secure information. Having some flexibility within that, as well as with what information we receive from claimants and their physicians, because again, doctors are busy, they're not looking to fill out a lot of forms. So depending on if there was hospitalization, being open to accepting other forms of documentation would be very helpful in allowing us at Acclaim or your provider to move through the review of claims quite quickly and being able to move files forward in case management. And then really being creative in terms of return to work options. Does this individual need to be in the office? Is there a hybrid model that is possible in order to keep people at work? Because we did see in some industries where the shift to having to work from home because offices were closed really did contribute to the decrease in overall sick claims. People had more flexibility at home, were able to maybe self-pace, So that was very helpful as well. So thinking about project work when it's applicable would also help in making sure that we can assist in accommodating individuals, keeping them at work, keeping them productive and safe at home.
Thank you, Dawn. Our next speaker is Dr. Mclaughlin, who is a co-founder of Vector Medical with a specialty designation in occupational medicine. I will not read all of his bio here. Again, you can read through that on your own, but we're looking forward to hearing Dr. Marcus' observations. Certainly, he would be involved in fairly complex disability claims situations. So getting some insight and perspective is going to be very valuable. So turning it over to you, Dr. Marcus.
Good afternoon, everyone. Thank you for joining us. I thought it'd be interesting just to talk a little bit about what some of the unique considerations that I've seen since the beginning of the pandemic in terms of health-related claims that have come across my desk. You know, to dovetail what Dawn was saying, I have noticed, despite the fact that there may have been a slight downturn in the number of disability claims overall, the number of companies that have been utilizing my services since the pandemic has started has actually gone up quite a bit. And I think that's because we're dealing with a unique situation where we're dealing with new items, new considerations, and new issues. And a lot of companies and a lot of disability management firms are looking for guidance in areas that have not traditionally been issues in the past. And I thought that I would highlight a few of them here just to bring to your attention, you know, what we're seeing as patterns in terms of the majority of what medical consultation is required from a disability management perspective. The first thing that I'm seeing a great deal of are requests for mask exemptions. And as you know, in order to work in the workplace or basically do anything indoors these days, we're all required to wear masks. This is, you know, not necessarily an N95, but it's just basically a regular surgical mask. And I would say that the three main reasons why I'm seeing doctors submitting medical documentation for mask exemptions for their employees would come down to skin irritation, anxiety, and breathing complaints. And these are not, excuse me, these are not issues that have traditionally come up in the past because we've never really had issues of having to wear masks in the workplace in the past. Now, these can be challenging files to adjudicate because obviously these are big issues for the individual employees, but may not actually hold medical water, so to speak, in terms of, you know, are they objectively real issues? Now, skin irritation is an interesting one because from my perspective, it's actually probably the most objective and most legitimate concern that mask wearing can present. And there's actually something that is colloquially known as maskne, which is an acne-type eruption that can happen from friction and occlusion with the wearing of masks. And this is a real phenomenon that we've seen with the COVID-19 pandemic. And actually, we saw also back when SARS happened back in the early 2000s. So it's not really a new phenomenon. And I would say that skin irritation is a legitimate reason for somebody to have a mask exemption because it can become really quite severe. And it's not, although it comes down often as a request for exemption due to skin allergy, it's not truly an allergic reaction, but it's truly simply an irritant effect, but it can become quite severe if it's not dealt with properly. But if somebody develops skin irritation as a result of masks, if it's dealt with medically appropriately, typically these people can go back to wearing masks. It's just a matter of finding the right mask, and at that point they can usually go back and have no further issues. But the main concern here is getting their face to settle down initially, and then finding a mask that doesn't cause their skin to react. This can also happen with face shields, and particularly where the face shield contacts the forehead. We see this quite a bit. We also see it with straps along the sides of the face. That can actually be a true allergy from the dyes in the strap. So oftentimes we have to work closely with dermatology in order to determine what the appropriate course of action is. But sometimes it might be something as simple as getting them to wear a cotton mask as opposed to a 3-ply surgical mask, and that might be sufficient. The next issue that we often see with respect to mask exemptions is the anxiety that surrounds the wearing of the mask. I don't often provide exemptions for anxiety unless I have a true diagnosis of claustrophobia. Claustrophobia is a DSM diagnosis, and it's highly specific. And unless I have that in writing, I'm not one to provide mask exemptions for simple anxiety to wear a mask. This is the new normal, and people have to really become accepting of the fact that mask wearing is part of life these days, and probably will be with us for some time. And it's not only something that they have to deal with in the workplace, but have to deal with in their everyday life if they want to go into stores, and if they want to, hang out with their loved ones, even on an outdoor basis. So I'm not one who puts a lot of stock into anxiety unless the word claustrophobia comes up as a DSM diagnosis in terms of getting a mask exemption. But we have to be very careful as employers not to substitute the face shields for masks, because I see that quite a bit, which is where an employer may ask me, is it acceptable because this person can't wear a mask, that they simply wear a face shield in lieu of wearing a mask? And then we have to remember that face shields don't provide the same level of protection as mask wearing does. So I don't think that is a legitimate alternative to wearing the appropriate personal protective equipment that's necessary for keeping people in the workplace. And the last one that we often see with respect to the request for a mask exemption is the issue of breathing complaints. And what this comes down to is the difference between wearing a mask and wearing a respirator. An N95 is a true respirator, whereas a surgical mask is not. A surgical mask does not increase work of breathing, which means that breathing complaints are not legitimate when wearing a plain surgical mask. So I typically don't accept that as a legitimate reason to not wear a mask in the workplace. And in fact, the Canadian Thoracic Society has come out with a statement specifically recommending that people who have respiratory issues specifically wear masks because of the fact that it adds a level of protection, and that this is something that they need because they may be at higher risk of severe disease in the event that they contract COVID-19. Now, that changes a little bit with somebody who is being asked to wear a respirator like an N95. If they have respiratory issues, then maybe they should be exempted from wearing an N95, but that does not apply to somebody who is simply being asked to wear a basic surgical mask. So it's important to distinguish between the two. So mask exemptions are important and frequent things that I see in terms of medical requests. The next thing that I would say that I see a lot of are requests for work from home arrangements. And I think that Don would agree that we see this in my work with a claim quite frequently, where we have employees who are in public facing jobs, and for one reason or another are saying that they either don't feel safe or have a medical condition which makes it unsafe for them to work in a public facing role and want to work from home. This can be a tricky situation in terms of how to approach it from a medical perspective. So the approach that I take is a risk-based one, and that basically suggests is what is the risk to the employee in the workplace. If the workplace is deemed safe, meaning they're taking all necessary precautions, there's mask wearing, there's social distancing, there is cleaning going on, and workers can be segregated in a reasonable manner. I'm not a big proponent of giving people, even with medical conditions, work from home arrangements, because I don't feel that the risk is particularly high. That changes in the situation where, for example, they might be going into an individual's home, or they might be working out in the public arena where it's a much less controlled environment. And the example that I would give you is somebody, for example, who works for Children's Aid, which is one of the clients that I frequently deal with. In that situation, you're going out into a house which is full of people of unknown health status, and that type of a situation may be more ideal to have that person with a medical condition work from home, as opposed to an office setting where there's nobody really coming in or out other than the individual employees that are working there, and the employees are subject to the protocols of the employer. And if the employer is deemed safe, for example, a hospital where they're taking extreme precautions going in and out, there may not be a need for the employee to work from home. It may be just as safe for them in the hospital as it is at home. So from a perspective of when to work from home, it's always important to take a risk-based strategy in terms of where they're working and what their medical conditions are. Finally, there's no question from a medical condition perspective, we're seeing a great deal of increased mental health claims coming across our desks right now. I'm seeing a lot more absenteeism related to mental health, and I think a lot of this has to do with stress related to the pandemic. I also do a lot of substance abuse work. I have an addictions clinic of my own, and substance abuse claims have gone way up. The amount of overdoses that we're seeing, the amount of substance abuse in the community has gone way up. And I think if you look at some of the statistics that are being put out by the various addiction organizations will tell you that since the onset of the pandemic, overdoses in general have gone way up. And I think a lot of this has to do with the stress of lockdown and just the sheer boredom of being stuck at home. So we're seeing a lot more of that as well. So there's the issue of having to deal with managing substance abuse both in the workforce and in the general population. And then finally, because of the increase in mental health claims, there's been a great deal of increase in requests for shift accommodation. So I'm seeing a lot of requests for people, for example, to avoid working nights, to avoid working evenings, and working straight days for one reason or another. And it can be a real challenge in order to try to navigate that, because we have to deal with mental health as a legitimate medical condition, but at the same time, access to psychiatry is very limited these days, and access to specialists during the pandemic in general has been limited. So we're left with managing these claims from requests from from family physicians, which oftentimes we're left with limited medical information, and then we're asked to adjudicate shift accommodation requests with, I would say, less than stellar medical information. and that can be a challenge in and of itself. And what I'm finding myself being left with are increasing requests for myself to speak with doctors and try to negotiate these types of requests on a much more frequent basis than I used to have to. And that obviously can be challenging for the employer, it can be challenging for me, and I'm sure it's challenging for the treating physician as well, because they're likely simply advocating for their patients, which is part of their role. So I would say that from a pandemic perspective, mask exemptions, work from home arrangements, and increased mental health claims are the three big changes that I have been seeing as a occupational medicine practitioner since the onset of this pandemic.
Super, thanks very much. I know a few individuals have posted questions. We've got just one more summary speakers, and then we will move to Q&A, because I know certainly the mask topic is a hot one, so we will address a couple of those in the Q&A. I'm going to turn it over to Henrietta Van Hoel. Henrietta leads a team of health and safety professionals at Public Service Health and Safety Association, so PSHSA. She started her career as an RN and then transitioned to occupational health and safety, which is where she remains focused today. So really looking forward to hearing your perspective. Henrietta, over to you.
Hi, thank you, and good afternoon, everyone, and thanks for being here. I'm going to talk about a few aspects of COVID, kind of from a health and safety and a prevention lens. And I'll make the assumption that everybody understands that the general premise of workplace health and safety legislation in Canada places the primary duty for protection of workplace injuries directly on the employer. And then there are roles and responsibilities for other workplace parties. So the employers in Ontario and in most provinces in Canada are required to follow explicit legislation, and then to protect workers, to implement measures and procedures that may be clearly or not so clearly identified. And they're also encouraged, wherever possible, to adopt leading practices as they evolve. So the other component that's a focus of legislation in Canada is that workers have rights under most of the occupational health and safety legislation. So the right to know about hazards, the right to participate in health and safety is another one, and in most cases, the right to refuse unsafe work where it applies. A couple of things that employers should be aware of is that they have the duty to do everything reasonable in the circumstances to protect workers from illness and injury. And when we think about the case that we're in now with a pandemic, that would be following public health guidance. It would be reasonable that you would follow public health guidance within your workplace. And in the context of COVID, that means things like physical distancing, providing the ability to work remotely where it's possible, cleaning, disinfecting, monitoring and assessing your HVAC systems to make sure they're functioning, having the screening processes in place, reporting, and personal protective equipment. And it really is kind of that layered approach that can help to keep COVID out of the workplace. And just looking at Ontario data, I get a report every day from the Emergency Operations Center, and there generally are over 150 workplace outbreaks every day in the report. So some of them are ongoing, but that's at a minimum, and that's taking out the hospital, the long-term care, and the group home. So that's general workplaces, not just healthcare. So if you didn't think you needed to pay attention to it, maybe that number will give a little bit of context. One component that I find we're getting a lot of confusion about is about mask use. So I know people have talked about it. So I just want to plant the seed to make sure that you provide enough education and training for your workers so they understand the difference between source control masking and when they actually need to use facial protection as personal protective equipment in the workplace. And that would include wearing a mask and also eye protection, because we know for COVID, we need to protect the mucous membranes of the face, which includes the eye. So making sure that as an employer, your duty is to make sure people understand what they need to do. The other component that I'll talk a little bit about is tied to the work from home and what that means from an occupational health and safety perspective. So a lot of the issues we're seeing is related to musculoskeletal disorders or ergonomic type hazards with working from home. So they may not have an appropriate setup, they may live in a condo, or they may just not have a lot of space, and they may be working on their couch, or they may be working on a kitchen table with a kitchen chair, and they don't have all the workstation setups that they would have had in the workplace. And while you may not have direct control over a home environment that a worker is working in, you should be providing support to ensure that workers are not injured while they're performing work away from the workplace. So a lot of resources are out there, practical tips, tools, free online training, work from home checklists. PSHSA has them. Your own provincial health and safety partner will have them. So making sure you do provide lots of those free resources. The other component, two components that I'll talk about, domestic violence and psychological health and safety, or mental health. Both of them have been kind of referred to as the pandemic within the pandemic. And when we think about domestic violence or intimate partner violence, it's actually doubled statistically as victims have been working from home. They're in close proximity and a lot of times to the perpetrator. So these great stay-at-home orders that were intended to protect the public and prevent infection have left domestic violent victims kind of trapped with their abuser. So there always have been some support. Some may argue that they were limited in the past, but at least they had an outlet. And just consider now that there are opportunities to leave the house and get help, even things like daily trips, taking their kids to school, going to groceries, having access to friends and families or coworkers have all been cut off. So what is your role, you might ask, as an employer from a prevention perspective? So I like to think about it as the 3 R's. So one is reducing stigma, recognize domestic violence, respond, and refer. So reducing the stigma would be about increasing education and awareness of domestic violence, recognizing it, paying attention to the signs and symptoms. So ensuring that your managers have knowledge of what the symptoms might be, and having a written policy or program to deal with domestic violence. Responding, so offering help. Remember, in most cases, you're not a therapist or a counselor, so you're not giving personal advice. Instead, you're moving on to the next step, which is to refer them for help where needed. And there's lots of free resources out there. One of my favorites is makeitOurbusiness.ca, where they have lots of information about how to have a conversation, creating a safe workplace, tips and tools, and how to create a safety plan. And then the last piece is about psychological health and safety. So I think a few people have talked a little bit about this, but I think we probably all recognize that the pandemic has increased stress across most of the population. Symptoms of anxiety, depression, suicidal ideation, and as Dr. Marcus said, alcohol and cannabis use have all kind of gone up. And some workers may have adjusted very well to living and working during COVID, and others might be tired and frustrated and just can't wait to get back to some normal. So, I think as employers, you want to acknowledge that there is an increase in mental health, call attention to it. And if you already have a psychological health and safety program, this is the prime opportunity to leverage the practices that you already have in place. And if you don't, provide information to workers. There's a lot of free federal and provincial supports available to people who might be struggling. And if you think about it from a psychological health and safety lens and what you might be able to put in place, and the fact that Canada does have a national standard for psychological health and safety, focusing on some of the 13 factors like providing psychosocial and psychological and social support, civility and respect, so those who may be struggling, and also looking at the psychological demands. So what's changed since COVID? Have you actually increased the psychological demands? So what can you do? A little bit, limit fear. So making sure you provide links to curated resources. The rumor mill is rampant with COVID and many other things, but making sure that workers know where they can get credible information, know where they can go for help, who they can call. If you have an EAP, focus on that. But there are also a lot of free online and phone supports that have been made through the federal government and also provincial mental health supports. And even just providing information to workers to support their own psychological well-being, reminding them to focus on things that they can control, to try and be prepared, to set boundaries if you think about it when they're working from home, making sure they still connect and communicate, even if they can't go and see someone in person. How else can they keep that connection and decrease the isolation that's happening? And then to protect themselves physically, which also decreases psychological stress, is to make sure they understand what the current public health guidance is and that they're following it. So just a couple of components there that I'll leave you to think about as we move into the questions.
Super, thank you very much. We've got just a few minutes left in our time with everyone today. So maybe I'll just jump to a couple of the questions and answers. If we aren't able to address the question that you've posted in the Q&A, we will circle back with you after the session. Maybe we can start with a question that pertains to where does an employer responsibility start and end when it comes to ensuring a safe work environment at home? So I guess, namely, does an employer have a right to validate a safe home environment?
I can start touching on that quickly. So, there's sort of a balancing act that you have to do in this current environment to a certain degree. I'm sure employers want to sort of take the big brother approach and really be a bit overbearing in making sure their employees are safe at home. But at the end of the day, both from a privacy perspective and sort of your legal abilities under the applicable occupational health and safety legislation, there's only so much you can do with respect to actually, going to visit someone's home, for example, that might be crossing the line. So what we've been sort of recommending from a balancing approach is instead doing something, and I think Henrietta might have touched upon this as well, but, sort of looking at like a hazards checklist as a nice balancing act with respect to an employer's duty to ensure that their employees are working in a safe work environment, whether it be from an ergonomic perspective to the domestic violence piece that was raised. It's difficult when you have very limited control over the physical workplace that your employees are in right now when they're working from home. But it doesn't quite extend so far as requiring you to go physically visit someone in their home.
Thank you. I guess just one more, I think we've got time for one more question. And I'm not sure, Dr. Marcus or Stephanie, this might be to either of you. If an organization has individuals in the workplace who are already maybe only wearing face shields because they had received a prior exemption, so no medical documentation was obtained in the early days. What can be done about this?
I'm not sure this is a medical question per se. I mean, from a medical perspective, it's simply not providing the same level of protection as a mask. I can't tell you what can be done about it. All I can tell you is medically, it's not advised.
Yeah, no, and you make a good point there, Dr. Marcus. It's not in line with the current public health guidance. And first and foremost, as an employer, you are required to have or to comply with your duty to keep an employee's workplace safe and your employees safe. And part of that is complying with public health guidance. Obviously, it's a tricky situation where your employees have been in the workplace for, I assume, some period of time now, just wearing a face shield. So, it's not going to be an easy conversation to go revisit that with them. But I think it starts with trying to determine, well, why were they only wearing a face shield in the first place or some other type of mask? And why can they not wear a mask going forward? And it would be a matter of making it clear to them that unfortunately that's not sufficient, both from their own health and safety perspective, but also for the safety of others, particularly if they're in a public facing role. And it may be that you have to go down sort of the path of getting medical documentation from them to support some sort of legitimate medical reason to not wear a mask, whether it be, the claustrophobia that Dr. Marcus touched upon earlier, or, you're dealing with some other type of accommodation where you have to move them somewhere else in your workplace to accommodate them, or even, if worse comes to worse, you may be dealing with a work refusal scenario. But it really will have to start with that conversation about, why it was just a face shield instead of a mask in the first place.
Thank you very much. So I am going to ask one final question, and I understand we are over time. So if anyone needs to drop off, I certainly understand that. We do have just one final question and we'll wrap up. And again, we will then respond to any others that we were not able to get to during this call. For each of the panelists, maybe you could spend just 30 seconds each and tell us your thoughts about what some trends might look like post-pandemic. So maybe another way to ask this is, what are we going to be talking about in May of 2022?
I can start since I went first at the beginning of this, but I think from an employee management perspective, there's going to be a ton more of these hybrid work from home models, both as a requirement to accommodate those employees who unfortunately are suffering from the long COVID, as it's been called, or other accommodation needs that come out of COVID, but also depending on the nature of your workplace, that's going to be a requirement to stay competitive. And it may very well be that you're allowing employees to work from all over your specific province, or maybe you're global enough that you can accommodate employees working from outside the country. But certainly that's something we're going to see a lot of, I think.
Thank you. Dawn,
I would
from a
agree.
disability perspective, and Dawn and Dr. Marcus, maybe from a disability standpoint.
Dawn, you're muted.
You.
Of course I am. Sorry, from my perspective, what I think, and we haven't seen it full blown, but we are preparing for even more mental health claims to come through the short-term disability, just related to post-traumatic stress, anxiety, those types of conditions, specifically related to healthcare. Some of our essential workers that have been frontline helping in the pandemic, and those essential workers from retail, manufacturing who are hesitant to return to the workplace and fear. I think we're going to see a lot of that. So we're actively putting together resources, programming to assist our clients and their employees with being able to navigate that, as well. Like Stephanie said, the flexibility and work from home. I think we're going to see a lot more accommodation requests that are going to be medicalized, that people need to be able to work from home, where perhaps that wasn't the pre-COVID norm in the workplace.
Thank you. Okay, Dr. Marcus or Henrietta, do you have anything to add?
I would just agree with the issue of long COVID. I think this is going to be something that sticks with us for some time. I do a lot of WSIB work on COVID-19, and the majority of the claims that I'm seeing these days are not related necessarily to entitlement to primary infection, but it's entitlement related to long COVID. And I'm seeing a lot of people who are persistently symptomatic with all sorts of vague and non-specific symptoms, some cases a year out from primary infection. So I think that this is going to be something that's going to stay with us for some time.
And I'll just add on that I hope in May of 2022, we're still talking about health and safety, because I think that's important. I hope we're looking at it from a more proactive lens, and we're talking about it more than just as it relates to COVID, that focus does not decrease. And I agree with Dawn. I think for our healthcare clients, we are going to see a whole host of mental health issues, and the compassion fatigue, particularly, in long-term care, and now in this latest wave, hospital workers, is going to be significant.
Wonderful. Thank you very much. And thanks to all of you for participating today. Chris, any closing notes?
Sure. Thank you to all of our speakers for sharing your valuable time and expertise with us today. That concludes our webinar. Thank you everyone for joining us, and have a great day. You may now disconnect.